Hey, this is Steve Spencer with the Birmingham Medical News. Welcome to our Doctor Talk podcast. Today we have Dr. Bill Smith with Cullman Regional. Dr. Smith is a general surgeon. He's been practicing surgery for 31 years, since 1987, and has been the medical director at Cullman Regional since 2018. And we do this podcast in combination with Cullman Studio and Company. We're actually in their studios. Cullman Company is an accounting firm that's almost 100 years old. Cullman does all accounting, business accounting, personal accounting. They have a really good healthcare department, and also they have a pretty strong wealth management program. And as for me, I'm the founder of the Birmingham Medical News. We have been writing a monthly newspaper. We've been writing about healthcare all over central and north Alabama for doctors, nurses, hospital administrators, practice administrators for 21 years now. So today's podcast is sponsored by Cullman Regional. And I can tell you, from having been in the healthcare community for a long time, in my opinion, Cullman Regional is a really impressive hospital. It is very difficult to survive as a rural hospital these days. We've had 13 rural hospitals in Alabama closed since 2009, and that includes 7 since 2015. From what I can tell, Cullman Regional has not only survived, they've really prospered. It's a 175-bed hospital that serves 5 counties and has been there since 1939. Cullman Regional has a little over 100 affiliated doctors. 50 of those are actually hospital-owned employees, but it's got a broad range of services. They have an outpatient imaging center, a sleep center, an urgent care center. Cullman also owns a fairly new Hartselle Health Park, and that includes an ER and an imaging center. And Cullman Regional also has a women's diagnostic center, hyperbaric wound care center. So I think it's a really probably, in my opinion, one of the best run rural hospitals in this state, if not, across the South. So with that having said, as I mentioned earlier, I wanted to introduce Dr. Bill Smith, who's a general surgeon. He is the chief medical officer of Cullman Regional. And today we want to talk about some of the, I guess I would say ideas, more than ideas, I guess initiatives that are taking place to try to help rural hospitals across the nation. Now, Dr. Smith, I know there's been a lot of activity, state and federal, on the state and federal level on rural healthcare, rural hospital concerns. Now, a lot of that takes place in 2026. And my first question to you is, what initiatives do you think could impact Alabama hospitals?
Sure, and first, Steve, I'd like to thank you for the opportunity to be here and represent Cullman and speak probably not too expertly on this topic. It doesn't really pertain to anything surgical, but it is a very, very important topic for Alabama, and particularly rural health care in Alabama.
Okay.
What the federal government has done is dedicated $50 billion to be distributed to states throughout the country for rural health care improvement over the next 5 years. And that initiative is called the Rural Health Transformation Program. In Alabama, it's the Alabama Rural Health Transformation Program. And the federal government asked that Alabama put together a plan as to how they would use the money. And then CMS, Center for Medicare and Medicaid Systems, will determine how much money is allocated to each state. And we should know December 31st how much Alabama will get year one. But it's been a very accelerated timeline since about July. The state legislature partnered with the Alabama Hospital Association to develop a committee to put together a plan for the state to submit back to the government in order to leave us in a favorable light so Alabama could participate in this distribution of money. And then the plan that was put together would really be the roadmap that would be used to determine how the money was allocated to different rural hospitals in Alabama. There are 53 rural hospitals in Alabama, and they all look different and feel different, and we're very proud of what we have in Cullman. And as you say, there are a lot of hospitals that are really struggling, more so than Cullman. But even hospitals, like you say, as successful as Cullman has been, still feels the financial pressure that even the most desperate rural hospital feels. The more services we try to offer, the more pressure we have, and we are dedicated to continuing our maternity service line, and recently opened a neonatal intensive care unit, partnering with neonatologists out of Birmingham to help staff our NICU, which was necessary to continue to offer maternity services. But only about 12 of 41 rural counties in Alabama are offering maternity obstetrical services. So this is a much needed.
I didn't know that it was that small number. That's interesting.
It's really really something. But once CMS determines how much money will be allocated to Alabama, then the Alabama Department of Economic Community Affairs, ADECA, will I think oversee the allocation of that money, and how that's allocated should follow the plan as it's written.
Okay.
Then there's also, Alabama had developed a rural hospital investment program. And just as a disclaimer, I'm not offering tax advice to anybody, but this is basically a dollar for dollar tax credit for individuals and businesses. If they want to contribute directly to a hospital through this program, then you get a dollar for dollar reduction in your taxes owed. I would encourage everybody to do that through an accountant to make sure it's done properly.
That is a big deal, because a tax
huge.
credit is very different than a tax deduction. That's a big deal.
Yeah.
And does the person, anyone who takes that credit, do they actually pick the hospital they want?
So they can pick the hospital. If they do not pick the hospital, then it goes into a fund that the Alabama Rural Hospital Investment Program Foundation would help determine how to allocate that to other rural hospitals. Each hospital could receive up to $750,000, and there are caps on how much an individual or a business could contribute. But it's that is I think an incredibly important complement to the federal program that's
I think it sounds like it. Will the tax credit only be for year 2026, or will you be able to do it in outgoing years?
I think it's slated to go over the next several years.
Okay. Yeah, I hope that you can kind of get. Obviously, we're getting the word out a little bit today, but I feel like that's something that a lot of people would be interested in it. And let's hope we can get the word out on that.
Yeah, I think it's huge, and that the last thing is the Alabama Rural Roadmap Initiative. Senator Garland Gudger, who's the president pro tem of the Senate, put this together, and it's a group to look at community health needs and quality of life issues, including health care in rural areas, and make actionable recommendations to the legislature for change that would also help dovetail into these other two programs. We're really fortunate that our CEO, Mr. James Clements, is on the Alabama Roadmap Initiative, and he has quite an extensive healthcare leadership experience in various regions throughout the country. The investment program was actually patterned after a program in Georgia that generated, I think, over $400 million for rural hospitals over about 8 years. So
that's incredible. That's really a big number. The roadmap. Now, when did they start working on the road? Now, I'm just curious as to how far along they are.
So it is really just this. All of this came together at the same time. Really,
Okay.
as this state committee was being put together for the health care transformation program, the tax investment program and the roadmap initiative were all begun.
Part of that.
Mm-hmm.
Okay. So obviously, if the roadmap work is started relatively recently, I guess it'll. Do you know how long it'll be before?
It will continue, as with these other programs. It's going to continue to meet and help provide information to help fund this. You know, the Alabama Rural Health Transformation Program, the federal money will be distributed over a 5-year period.
Okay.
So our feeling is this will kind of transcend about a 5-year time frame.
Okay. And can you anticipate what impact any of these programs will have on rural hospitals, like on your hospital, on Cullman, for example?
So, you know, a lot of it depends on, on really the committee and how the committee recommends to ADECA how the money should be distributed. I'm not real sure how it will help us. We're hopeful it does provide help because, as I said, Cullman is just as much in need of financial support as any other rural hospital in Alabama. But there are about 53 rural hospitals in Alabama, 16 of which are independent, like Cullman.
Okay.
And 2/3 of rural hospitals in Alabama are affiliated with a system like UAB or Huntsville, or even systems that are located out of the state. And so these hospitals, through their system affiliation, have opportunities for financial support that those of us that are just totally independent just don't have that safety net.
Sure.
But and we're just hopeful that our success doesn't work against us when it comes to money.
I was thinking that as you I knew that's where you were going. That would be really sad and kind of frustrating.
And we've really worked hard to try to offer services, and to be honest, gone out on a limb just to provide maternity and nursery services.
Yeah, which is so. Sorry, breaking down. That's so important. I mean, you don't want a lady who goes into labor to have to drive an hour.
Right.
I'm sorry, I broke in on you.
Well, no, I mean that's true, and the access in Alabama. I mean, part of the purpose of the plan that was put together for the managing the federal money was basically to look at transformation of rural health care, sustainability of rural health care, and overriding accountability of what's being done.
Okay.
And to me, that just speaks to, I think the real emphasis is transformation and sustainability. You want to look at each individual rural area and look at what their unique opportunities are and their unique challenges are, and try to taper the healthcare system into something that works for the entire state. It would be, I think, very unique to each individual area, but at the same time, you're trying to assure access to healthcare. And when you take something like maternity services, you want people within a reasonable distance of where they can deliver a baby. And right now, in the state of Alabama, there are a lot of people hurting because of all the maternity obstetrical services that have closed. Yeah,
I can imagine. I mean, because I guess not only when you go into labor, but those 9 months leading up to that. Because, I remember, I'm a dad of 2 kids. I remember so much we did along the way. You're seeing your OBGYN on a regular basis. You're getting kind of healthcare advice along the way. That it gets me. Well, let me ask you this: Are there any particular opportunities you see with the upcoming initiatives?
So I think there are huge opportunities for rural healthcare in general
Okay.
in Alabama. I mean, I think the challenge is making sure that we focus on the needs of rural hospitals, support the rural hospitals, and develop the rural hospitals in a way that really dovetails into the needs of healthcare in the state of Alabama. And, you have to differentiate between independent hospitals and independent and rural hospitals that are part of healthcare systems, because they operate different and they provide different services. I mean, we provide a lot of specialty services in Cullman that when you look at other hospitals that are part of systems, many of those services would be pulled to a metropolitan area and be done there. I mean, that's a good business move, and it's not to belittle how that's done, but just to point, healthcare systems are a valuable component of our whole healthcare delivery in Alabama. And the tertiary services that they provide are very important. But we want to keep the balance there so that as they make the business decisions they have to make to provide the care that they provide, it doesn't unfairly affect those of us that are providing it a little different way. And I think that that is probably the thing that I see as a big concern, but at the same time it could become a good opportunity for us and for the state when it comes to defining how healthcare will be delivered in rural areas.
And I assume, tell me if I'm wrong, but I assume that Cullman has probably had some population growth because Huntsville's grown so much. Has that been the case, and has that put some strain on the hospital?
Absolutely. I mean, we have. The county has grown significantly. The traffic through Cullman is huge.
Okay.
Geographically, Cullman is located in the center of Cullman County. It's right on I-65. There are a lot of smaller communities around the city of Cullman, and all of the trade occurs in Cullman. So it lives a lot bigger than the stated population of the city of Cullman, but the county is over 90,000 people.
Okay.
And our immediate market area is over 150,000 people.
So I would think with 175 beds, you're probably fairly strained. Is that correct?
We are, especially the last couple of weeks. So we've had anywhere from 157 to 165 patients in the hospital just over the last couple of days.
Okay.
And we have our ups and downs, but right now with the cold weather, there's a lot more respiratory illnesses, and that's sort of increased things. But we also find ourselves with people that really need a higher level of care that we have a hard time getting to UAB or to Huntsville because they're full.
Oh yeah.
And they're on diversion, and so our presence is very important to the people of Cullman because we can take care of them and we can do what needs to be done. But I shudder to think what would happen without hospitals like us in that.
Well, let me ask you this: the various initiatives that we're talking about. What are the most important things for people who are watching this, listening to this, for people to understand as these initiatives begin to roll out?
So I think first of all, it's another way to for Alabama to benefit from federal funding and it be directed specifically into rural health care, which is a tremendous need in Alabama. It's going to be spread out over several years, and the decision making of how things are done, I think it's good for people to be aware of that, and if they see something that doesn't appear to be being addressed, get in touch with your legislator or, to let them know that, hey, we don't forget about this. But I think more than anything, just understanding that's available, and then understanding about the investment program with the tax credits that you can get, because that's something on a personal level that people can do and directly impact the hospital, a rural hospital that they designate.
Yeah, I would think so. Was there anything else that we've missed that we need to touch on?
I don't think so. I mean, I think that, I'd just like to reiterate that, Cullman is an example of exceptional care as a rural hospital. We're a large, diverse rural hospital with a lot of services that our community wants and needs. We've grown and provided tremendous economic impact, and we provide over $50 million of uncompensated care to uninsured people in our community.
Ooh, that's tough.
And those, that little profile of Cullman is repeated all through the state in rural hospitals. And keeping attention on rural hospitals and rural healthcare needs, I think, is very important.
Sure. Well, thanks a lot for coming in and some great information. I was unaware of all this until today, actually.
Appreciate the opportunity.
Absolutely.
Thank you for listening to today's episode of the Ask the Doctor podcast, brought to you by the Birmingham Medical News and Kasufin Company. Please make sure to like and subscribe, and make sure to tune in for our next installment. I'm Steve Spencer, and wish you and your loved ones a healthy journey until we see each other again.